Good day. I am Dr. K Gireesh, physician, neurophysician and neurosurgeon. As a part of the CME program, Continuing Medical Education Program for creating awareness in the general public, and on behalf of Padma Clinic and Nursing Home, Chennai, as well as on behalf of Lions Club of Madras Excellence, today I'll be talking or dwelling a topic on cholera and a bacterial disease. I'll give you an overview of cholera, especially about the bacteria, the causes and the prevention. Cholera is a bacterial disease usually spread through contaminated water, and cholera causes severe diarrhea, loose motion and dehydration, loss of water. Left untreated, cholera can be fatal within hours, even in previously healthy people. So, the symptoms of cholera infection is diarrhea, loose motion. It comes on suddenly and quickly and causes dangerous fluid loss. There will be so much of loose watery stools, about almost 1 liter in an hour. The diarrhea due to cholera often has a pale, milky appearance that resembles water in which rice has been inserted. That is why it's called the rice water stools. In addition, you may have vomiting, nausea, and you tend to shrink, lose what you can say, the dehydration. It develops within hours after cholera symptoms. A loss of more than 10% of body weight indicates severe dehydration. There will be irritability, tiredness, sunken eyes, dry mouth, and you will also have sometimes low blood pressure. Apart from this, you have muscle cramps. Sometimes the patient can go into shock. That means low blood pressure because of hypovolemia. So, decrease in blood volume can produce shock. Now, the causative factor for this is a bacterium called Vibrio cholera. This is the one which causes this infection. As this bacteria goes into your intestine, it releases a toxin, and this toxin causes the body to secrete enormous amounts of water that leads to the rapid loss of fluids and salts. Cholera bacteria might not cause the illness in all people who are exposed to them, but they still pass the bacteria in their stools, and they can contaminate food and water supplies. Now, this bacterium, where is it found? You will find it is found in public wells, especially when there is an large scale cholera outbreak, crowded conditions, without adequate sanitation, people are at risk. Seafoods, eating a raw or undercooked seafood, especially shellfish like crabs, and they can have cholera bacteria. Raw fruits and vegetables. Raw unpeeled fruits and vegetables are a frequent source of cholera infection, especially where their cholera is rampant. In regions where cholera is widespread, you find grains such as rice and millet that are contaminated after cooking and kept at room temperature for several hours can also grow cholera bacteria. Poor sanitary conditions can produce cholera, especially in refugee camps, impoverished countries or areas afflicted by famine, war or natural disasters like floods. There again you can have poor sanitary conditions and accordingly cholera. Sometimes you find cholera bacteria can't survive in an acidic environment. And ordinary stomach acid often serves as a defense against the infection. But people with low levels of stomach acid, like children, older adults, and people who take antacids like H2 blockers or proton pump inhibitors, they lack this protection of the stomach acid. Then, especially undercooked shellfish, if you eat, you find they can harbor this bacteria and thereby one can develop cholera. And the complications, it can quickly become fatal. The rapid loss of large amounts of fluids in almost an hour, you find they go into a shock. Shock means low blood pressure, dehydration, rapid pulse, numb, cold skin and clammy skin. Other complications can be sugar also falls low, potassium goes low, because of large quantities of minerals including potassium, they lose in their stools. Then ultimately they can develop kidney failure. Now let's see the prevention. If you are traveling to areas known to have cholera, your risk of contracting the disease is extremely low if you follow these precautions. So what are the preventive measures to prevent infection from cholera? The most important is wash your hands with soap and water frequently, especially after using the toilet and before handling food. Rub soapy, that is wet hands together for at least 15 seconds before rinsing with the water. If soap and water aren't available, you can use an alcohol-based hand sanitizer. This is one of the most important aspects of preventing cholera. Usually it spreads from the hands. Drink only safe water. That means bottled water or water you have boiled or disinfected yourself and then poured into a bottle and can be taken. Hot beverages are usually very safe, as are canned or bottled drinks, but wipe the outside before you open them. And don't add ice to your drinks unless you made it yourself using safe water, especially the ice. Very important. Eat food that is completely cooked and hot. Avoid the street vendor foods, especially if you find the vendor foods are exposed and there are a lot of flies. Avoid eating the vendor foods. If you do buy a meal from a street vendor, make sure it is being cooked in your presence and then served hot. Avoid raw fish and other aspects, especially if you do not know how they are being prepared. Stick to fruits and vegetables that you can peel yourself and then eat it, such as bananas, oranges, avocados. Stay away from raw salads and fruits that can't be peeled, such as grapes and berries. Otherwise, you should get it, wash it very well, thoroughly rinse it, at least for 10 to 15 minutes before eating it. So, eat the food that is completely cooked food, and hot food is best to eat. The basic prevention steps: be sure you drink and use very safe water. Wash your hands often with soap and safe water. Toilets should be really clean. Before and after using the toilet, wash your hands. Cook the raw fruits, that is fruits and vegetables. See that they are being boiled and then only you should eat it. Now, it is said that there are more vitamins are being retained, especially with raw foods, like raw vegetables. Yes, it is. But to prevent infection, it is better that we cook it and eat it. Wash it very well, 5 to 10 minutes, thoroughly wash it. Rinse it what you can under running water and then boil it and then eat it. And also, your kitchen should be thoroughly cleaned every week, because I strongly feel the kitchen is a temple of the house. That's a place where all the food is being cooked for you to consume and for you to have lots of energy. So these are the basic steps in preventing cholera infection. Thank you very much.